When you have a child with any type of a special need, it obviously is going to affect the family because many changes have to happen in terms of being able to understand how to work with the child, how to facilitate the development of the child. And families oftentimes struggle with feeling guilty in terms of having a child with autism because for so long in the 60s and the 70s, it was thought that autism was caused by poor parenting, that parents weren't loving and weren't cuddling and weren't caring enough, and that's why their child became autism. And though we know that this is absolutely not true, there's still a level to which that guilt kind of continues as parents now find out that they have a child with autism. So it's a matter of knowing that as a family you're not alone. In fact, the prevalence rate of autism is increasing at an alarming rate. And when you get the diagnosis initially as a parent, you feel like I'm all alone, where do I turn, what do I do? And families can do best by finding appropriate support groups and finding that there really are many other people who have been through the range of autism and have experienced the same emotions and have gotten through it and now have adult children who are functioning quite well who have autism. But we do know that getting everybody on board, let's say with being able to implement certain behavioral strategies or certain intervention strategies can be difficult. Being able to know how much time to give to your child with special needs versus your children who might not have those special needs. And it's always difficult to raise a child that has a special needs, whether it's autism or not. So it can have a very powerful effect on the family, but it also can bring families closer together. Sometimes what you see is grandparents, aunts, uncles, cousins becoming more involved in wanting to help the child be able to maximize their potential. So you actually, a lot of times when I give lectures, when I do trainings, there's so many extended family members who are there because they want to learn too and they want to be able to be involved in helping the child. So it has both positive effects, and of course it's a devastating diagnosis to get. But again, as has been identified, is the earlier you can get intervention, the better. And the faster you seek out the diagnosis. A lot of times parents think that getting the diagnosis of autism closes doors on them or closes doors on their child's future. But actually, we encourage parents to view getting the diagnosis as being able to open every possible door, because now you know what it is that you're dealing with, and you know what your child needs. Your child needs intervention that's specific for their specific needs with autism. And you can open so many more doors by getting the diagnosis early and getting the treatment early, rather than kind of procrastinating and putting it off because you don't want to hear those words.